When we talk about fatigue in general, there's sort of five-ish categories of things that I tend to see a lot as a family doctor. Now, this is not to diagnose your fatigue, it's to give you some ideas and also to let you know why it's important to see your doctor if you have fatigue that's unexplained or anything else going on with you, right? Super important, okay? So the first main cause of fatigue that I see in my patients, I've been in practice for 13, 14 years, actually is caused by lifestyle issues. Believe it or not, when I talk to people about fatigue, first thing I ask them is, well, tell me about how much you're sleeping at night and what you're doing and what's going on. And I would say for many of my patients, lifestyle issues are a cause of their fatigue. Let me give you an example. So sometimes I have patients that simply are not sleeping enough. They're tired because they're going to bed too late or waking up too early. Or they're doing what so many of us do when we get into bed. We lay down and the first thing we do is scroll on our phone, right? And we scroll and we scroll and we scroll for hours perhaps, and before finally going to bed. Remember, all of those types of things disrupt sleep and keep us from sleeping. If you're laying in bed watching TV or scrolling in your phone, you're not sleeping. So when I talk about lifestyle changes and lifestyle issues, one of the main causes of people being tired is simply not sleeping enough, okay? The next thing I see is, what we're eating and drinking. Number one, eating meals too heavy, too big, close to bedtime can make it hard for us to sleep well. Also, if you're drinking liquids too close to bedtime or up to bedtime, this is a problem. I can guarantee you're going to be up every couple hours peeing at night. And you know what? You're not going to sleep when you're up in the bathroom, and therefore you're more likely to be tired the next day. Another issue with regards to what we take in our bodies is alcohol. Alcohol is, might make us feel drowsy and sleepy, but it's notorious for interrupting sleep. All of these things in terms of eating, drinking, what we drink, how much we drink, can all impact our sleep and thus can contribute to being fatigued the next day if our lifestyle is not conducive to this. The next thing is that, believe it or not, getting too much sleep can actually make you tired the next day. I know, paradoxical, I get it, but it's a thing. If you're sleeping too much, you can actually be tired the next day. And I know probably many of you have experienced this, you know what I'm talking about. And of course, we did already talk about not sleeping enough. The other thing I would say with regards to, being fatigued, and now this, what I'm about to say, really has less to do with being tired and more to do with insomnia, which I'm going to talk about next. Insomnia is the inability to sleep. But a lot of us don't have really great sleep hygiene. That is, like at nighttime, making sure that we're keeping the room nice and dark, right? Nothing beeping or buzzing, no light shining. Making sure that our room is cool. I actually sleep with in my house. I keep my bedroom at 67 degrees at night, and then I have a fan on at night as well because it keeps me nice and cool. When it's too hot, we don't tend to sleep as well. Making sure that we're winding down before bedtime, that we're not exercising or doing any crazy activities. Those are, sleep and sex for the bedroom only, as opposed to working a lot and being stressed out and stuff in the bedroom, sort of identifying our bedroom with sleep. That is what we call sleep hygiene. Those are ways to make sure that our room is conducive to sleeping. And that, even though it's not necessarily a cause of fatigue, good sleep hygiene can help you sleep better, which might help your fatigue. So the first category is all that stuff I just mentioned, which is lifestyle stuff. What are we doing? When are we going to bed? When are we waking up? Are we looking at our phone all night? Are we peeing all night, okay? Either because we have a large prostate or because we're just drinking water up till bedtime. All of these things can affect how fatigued we are. Now, let's move into some other, and I'm not going to call them obvious, right? Those are not always obvious, right? But let's move into other, underlying medical conditions that can cause fatigue. And this, again, is why I'm telling you this, because I have a lot of patients that I think don't realize that sometimes their fatigue can actually be what we call pathologic, meaning it could indicate that there's something else going on. And I want to know about it as their doctor, and I need to know about it, and I should know about it, because it could be, a symbol that there's something else in your body that's not quite right. So that's what we're going to talk about now. Category 2 of things that can cause you to be more fatigued than you should be are what I would consider to be deficiencies. Either vitamin deficiencies or things like anemia, which is really sort of a deficiency of red blood cells or not enough blood in your system. So we'll start with anemia first. Anemia is one of these things that, I have sometimes, women who have maybe heavy periods and, they tend to have lower hemoglobin or blood levels, and they may not realize that they're kind of operating on a half tank of gas, is what I call it, because they don't have enough blood to carry the oxygen and to help with things that can result, from anemia, one of them being fatigue. So anemia can be a cause of fatigue. Also, things like vitamin deficiencies, such as vitamin B12, vitamin D, etc. For me, as a family doctor, I see those as a cause for anemia a lot less than I do anemia. Excuse me. I see vitamin B12 and vitamin D as less of a cause for fatigue than I do anemia, but it's important to know about it, okay? Number 3, the third category of things that cause fatigue or can cause you to be fatigued and you not even really understand, why you're feeling this way is, believe it or not, depression and anxiety, mental health issues. You all would, maybe you do know, okay? But you never believe how much our mental health can really impact our physical health. And I know so many patients that may be struggling with depression, anxiety, bereavement, grief, post-traumatic stress disorder, you name it, bipolar. Mental health conditions can absolutely impact the way we feel and can cause fatigue, either because we're not sleeping enough, because we're sleeping too much, or some other reason. Sometimes even the medications we take can cause us to feel tired, by the way. And actually, I should have put that as a separate category of its own. Okay, we'll come back to that because I'm going to put that in a category. So keep that in mind, that honestly, when somebody comes to me and they're saying, oh, I just feel so tired, I just feel exhausted, some of the questions I'm asking has to do with mental health. How are you feeling? Are you happy? Are you sad? Do you cry? Are you anxious? Because I want to know, because these things can absolutely impact mental health. Okay. So now let's go to the category that I had not planned, but I'm going to throw in there now, which is category number 4, which is medications. Yes, guys, so huge. There are a number of medications that can cause us to feel tired. And they can range from blood pressure medications to, let me think of some common, I hadn't had this one planned, so I didn't think through this all the way. But blood pressure medications, definitely, I sometimes hear. Depression, anxiety, mental health medications, I oftentimes hear can make people feel tired. Docs and mental health professionals and other people comment if you can think of some things off the top of your head. The truth be told is any medication can honestly cause you to be tired. I mean, yes, there are some medications that are more likely than others to do that, but the truth be told is I have patients that respond in different ways to different things. But I would say the most common classes and categories of medications that people complain of fatigue with, probably blood pressure medications, and then mental health medications, antidepressant medications, and things like that. But there are others as well, okay? All right, moving on. Let's go to category number 5, things that can cause you to be fatigued. That really, and again, fatigue in and of itself should signal you should go to your doctor. The thyroid. I put that in a category all in and of itself because the thyroid is notorious for this. The thyroid is a gland that sits right about here. I actually did a video on hypothyroidism. You guys should check that out. That's when you have an underactive thyroid. But the truth be told is that sometimes people with overactive thyroids, their body is acting wonky too, But thyroid disease can totally make you feel sluggish and, sleepy and fatigued and just with a lack of energy. That is really important. And once again, this is not for you to necessarily diagnose yourself because you may or may not be able to. Aside from the first category that I mentioned, which is the lifestyle changes, and I do want you to think about that if you're feeling fatigued. First thing you should be thinking about is, okay, number 1, am I sleeping at night? I mean, maybe I'm just tired because I'm not sleeping. I'm either going to bed too late, I'm getting up too early, or I'm on my phone all night long, or maybe I got the TV on, or maybe I'm doing stressful things in the bed and I don't have good sleep hygiene, or the room is not conducive to sleep, or things like that. That's probably the first place to start. Now I would mention the last thing that I want to say about conditions that can cause one to feel fatigued is conditions that really have to do with fatigue itself, almost as a primary issue. So what am I thinking of? I'm thinking of things like sleep apnea. Sleep apnea is a condition where you literally stop breathing during the course of the night and you don't usually know it, and therefore you're tired the next day. So sleep apnea really is notorious, again, just like thyroid and some other conditions, for making you feel tired. So one of the reasons why I'm doing this session is if you are tired, I want you to talk to your doctor, because you might need to be screened for sleep apnea or some other condition as well. There's also other conditions, what we call primary sleep disorders, things like narcolepsy. Okay, you have altered sleep patterns, okay? Narcolepsy is a huge one. There's also other conditions like fibromyalgia. Fibromyalgia is a chronic pain condition, but fatigue is a hallmark symptom of fibromyalgia. And then there's what we used to call chronic fatigue syndrome. Now we call it systemic exertion intolerance disorder, but that also has a hallmark symptom of fatigue as well. You know, this is not to overwhelm you. This is to kind of let you know some of the things that can be underlying your fatigue. There are many things, so don't be overwhelmed, but just know that if you're tired and you don't know why, really come to us and talk to your doctor. It's really, really important. I would also say something else that's really important, along with lifestyle, that I didn't mention before, is shift work. I have a number of patients who work shifts. They work the graveyard shift, they work overnight. I have a number of healthcare workers that work, the overnight shift. They may be nurses or respiratory therapists, etc. And it can be sometimes difficult, hard to regulate our sleep cycles, and thus can contribute to fatigue if that's what we're going through. So guys, I want you to keep all of this stuff in mind as you think about what's going on with you. And if you're tired, I want to make sure that you're talking to your doctor about this, because it's the most important thing that you can do to make sure you get a proper diagnosis. What I do when I have a patient that's fatigued is I get blood work. We do a history and physical, listening to their heart and lungs and all that good stuff, doing a physical exam, but also finding out the story is important, and asking questions about depression, anxiety, lifestyle changes, etc. What do you do for work? What's your schedule like, etc. And then often I'm checking blood work too. So I hope this is helpful, guys, for thinking about, well, if you're fatigued or if you know someone who is, these are places to start. I definitely want to make sure that you guys are talking to your doctor, because it could not be more important. All right, guys, I love you.